where we're going with some of the developments in the field is how to make our treatments, number one, safer for patients and more tolerable, but then also identifying treatments that may be helpful for those double relapsed or double refractory patients. So we know that BTK inhibitor therapy is a great option for patients. A venetoclax regimen is a great option for patients, but we are seeing patients that have now progressed through both of those lines of therapy. And that's where the additional treatments are a little up in the air. There's not a standard the way there is with sort of first line and second line treatment. Fortunately, recently we've had the FDA approval of pirtobrutinib, which is a non-covalent BTK inhibitor that can be utilized for patients that have developed a BTK resistance mutation. So that offers some option for patients, but even the progression-free survival on pirtobrutinib for patients that truly are double refractory to venetoclax and BTK inhibitors is relatively short. So we need other options. And that sort of brings up one of the other important pieces that I think APPs need to know about treating CLL patients is knowing when to reevaluate the patient's cytogenetics and molecular testing so that we can identify the most appropriate treatments for these patients. At Dana-Farber, we have a molecular panel that's sort of homegrown that allows us to identify for BTK resistance mutations. And that's really helpful to do if we have someone that's progressing on a BTK inhibitor because it allows us to understand whether a different BTK inhibitor may be an option or we need to switch to a different covalent BTK inhibitor, I should say, or we need to switch to a non-covalent BTK inhibitor. So that is extremely helpful. And as we learn more about the different BTK resistance mutations, we are already identifying certain mutations that may not respond as well to even non-covalent BTK inhibitors. So again, an important piece of the puzzle to evaluate for before you're choosing your next line of treatment because it may include or exclude what your treatment options could be. And that brings me to one of the more exciting developments in the CLL field is the BTK degraders. So this is yet another option for our patients that have BTK resistance mutations to covalent BTK inhibitors that may have progressed on pirtobrutinib. It again allows them to have another BTK inhibitor option that so far in the trials looks like it's pretty tolerable and effective as well. So that's a really exciting development. We also are seeing newer versions of BCL2 inhibitors. So really venetoclax has monopolized the BCL2 inhibitor area, but now we're seeing sonrotoclax in trials and other ones sort of coming up sort of in the lower clinical trial space. So I think that we're trying to develop these newer medications that are both very well tolerated and will work for these patients that have already seen the older versions. So a lot is very exciting and I think is very needed in that third line plus space because again, our patients sometimes are getting treated or getting diagnosed younger, are having more aggressive disease features, so needing treatment younger, and eventually they are going to bypass our traditional treatment options, and then we really need to have other things available for them.